When you start to do your Medicare research, there's so much information out there. There's 50 million pages of Google articles, videos, so much telling you everything you need to know. But it's hard to kind of decipher what's important and what's not. So today I'm going to do a Medicare Explained video where I'm going to break down the different parts of Medicare and tell you the basics of what you should really know when you start doing your research. So stay tuned. Hi, I'm Jamie Banner, and I'm the founder of Medicare by Jamie. I'm a licensed insurance agent that works specifically with people enrolling into Medicare, and today we're going to talk about Medicare Explained. All right, we're talking about all things Medicare, all the parts of Medicare, and the basics that you should really know when you start doing your Medicare research. Because like I said before, there's a ton of information out there, and it's really overwhelming, and it's just important to know exactly the basic parts before we take our deep dive in. Before we get started, if you find the information in this video helpful, I'd appreciate if you a thumbs up and subscribe and leave a comment down below. It lets YouTube know this is important so more people can look at Medicare Explained. So let's get to it. First question is, who can enroll in Medicare and when can you enroll in Medicare? So there's different groups of people that can do their Medicare enrollment. It's not just one group of people. But the first one that everyone thinks about are people turning 65. So when you get near your 65th birthday, you're going to start getting all the Medicare information because you can start your Medicare at age 65. So you can start your enrollment at 64 and 9 months to have your Medicare Part A and Part B start the month of your 65th birthday. So that's kind of the time frame most people think of is turning 65, time to start Medicare. But that's not the case for everyone. For instance, some people keep working past 65 and don't need to start their Medicare. Maybe they've got a spouse who is not Medicare eligible. Maybe they've got amazing employer benefits that they don't want to give up quite yet. So another group of people who can be coming into Medicare are people who are retiring. So maybe you're retiring at age 72. Maybe you're retiring at age 92. You can start your Medicare enrollment then, and as long as you've had credible group coverage from your employer or your spouse's employer, you can jump in just like you're turning 65. Got videos that explain whether you're coming in at 65 or retiring. I'm going to link it down below. Gets a little more in depth to figure out which group you fall into. Another group that might be getting into Medicare are people on Medicare disability. So if you're on disability and you're younger than 65, once you've been on disability for 2 years, you can enroll into Medicare. And again, I've got a video all about who's eligible. Link it down below. So now we know who. Let's talk about the what. So the first one is Medicare Part A. This is your hospital coverage. So your Medicare, for the most part, is split into two different groups, Part A and Part B. Part A we can think of as the hospital. Whatever happens as we're an inpatient in the hospital falls under Part A. So this, very important, you have to be admitted to the hospital and be an inpatient for it to be Part A. So if you go to the emergency room, you got a couple scrapes and they send you home, that's not Part A. But if they keep you overnight in the hospital as an inpatient, you are under Part A. So that's a whole separate part of Medicare. Part A generally has no premium as long as you've worked at least 10 years. And most people enroll in Part A when they're turning 65, regardless of whether they're going to stay on their employer coverage, because there is no premium. So Part A has no premium and it covers your hospital stay. It's very important. The next part is Part B. Now, this is our outpatient, is what I like to think of it as. So doctor visits, lab visits, anything that happens outside of the hospital falls under Part B. And that includes things even too like outpatient surgery. If you get some outpatient surgery because you're not admitted, that's Part B. So Part A was that hospital. Part B is everything that happens pretty much outside or after the hospital. Part B does have a premium. So the base premium for Part B in 2020 is $144.60. And Part B is kind of what I like to call your Medicare trigger. So most people don't enroll in Part B if they're staying on their group coverage because Part B, A, has a premium and B, triggers a time period. So when your Part B starts, if you want to enroll in a Medicare Supplement plan, you've got 6 months from your Part B starting to avoid any health questions and possible denials. So if you start your Part B when you don't need it, you can run out that 6 months really quickly and you get put in some other more complex situations that you don't need to be in. Plus, if you've got coverage and you're paying both, you're paying for two insurances that don't really work well together. But everyone else, if you're turning 65 and you're coming into Medicare fully, you're going to start your Part A and your Part B. So you've got your hospital coverage and you've got your outpatient coverage. Thing about Part B, though, it does not cover 100% of your outpatient. Part B covers 80%. That leaves you responsible for 20%. And now 20% doesn't sound like too much, but it can be over time. You've got to think medical bills can add up. So there's a couple different things you can do to take care of that 20%. Also, your Part A in the hospital has a deductible. Want to take care of that too. So what can we do to get ourselves some extra coverage? That's where you have a choice. So we've got original Medicare versus Medicare Advantage. So when you start your enrollment into Medicare Part A and Part B, you're going to take one of two paths. You're going to go original Medicare A and B with a supplement plan, or you're going to go to a Medicare Advantage plan. And these two plans are very different. They're pretty much opposites. You go one or the other, and you can't have both, and they don't work the same. So you really got to know which way you want to go, whether you want original Medicare or a Medicare Advantage plan. First one I'm going to talk about is original Medicare. And that's because that's what I do. I assist people in finding supplement plans to go along with their original Medicare. If any questions, you can call me, 833-65-JAMIE. There is no cost to you. I will work with you specifically to find the best Medicare supplement plan for you. And that's if you choose original Medicare. So original Medicare, you have four parts. You have your Part A, which you said was your hospital. Part B is your outpatient. Then we get our Medigap Plan, also known as a Medicare Supplement Plan. So this is going to cover that 20% that Part B does not cover, as well as your hospital deductible under Part A. So you pick up this Medigap Plan to cover the holes in your Part A and Part B, cover the gaps, supplement that coverage. You see all the semantics? And then the fourth part is a prescription drug plan, because original Medicare does not cover your prescription drugs, and neither does your Medigap plan. So you would have Part A, Part B, a Medicare supplement plan, and a prescription drug plan. So all four parts, A, B, C, D, just like the alphabet, and then you're done. That's all the coverage you need under original Medicare. So with original Medicare or a Medigap plan, great benefit is no networks. So you can use this plan anywhere that accepts Medicare, accepts your supplement plan. That's fantastic. So if you live in Florida and you want to go to a hospital in New York, a hospital in California, in Oregon, you can take your supplement with you. It travels with you. This is great because, once you get retirement age, you might want to travel. You might have family in another state you go see, and you don't have to be scared to use your plan because your supplement plan follows you to all 50 states. You can use it in Alaska. It follows you everywhere. It's fantastic. The other thing about the Medigap plan is it's low out of pocket. So generally with these plans, you have your premium, your Part B deductible, and then that's pretty much all you're out of pocket for the year. And that Part B deductible is $198 annual deductible. So that's nothing compared to the deductibles we've had working on group plans. And then you've got no more out of pocket. You know that you can use your plan and you've got this great coverage. I mean, it's so nice to know that you're not going to be receiving tons and tons of these huge high medical bills with your supplement plan. That's a really great feeling, especially when we're into retirement age. We don't want to worry about having to follow things like that. We want a plan that works for us. On the flip side, you have your Medicare Advantage plans. So Medicare Advantage plans work a little bit differently. Generally, they do have networks. So you have a network of hospitals and a network of doctors you can use, and it's all tied to your zip code. So you enroll in this plan based on where you live, and that's where your networks fall. So you need to make sure if you go in these plans that your doctor's in network, your preferred hospital, and also you need to know that they can leave that network at any time. So if you choose a specific plan because your doctor's in it, if your doctor leaves, you're still in that plan until open enrollment. So that can get a little bit tricky if you really like your doctor. Makes it a little bit hard with the networks because you can sure go outside of your network, but you're looking at some out-of-network charges that can get really expensive really fast. The other thing with Medicare Advantage plans is They've got low premiums. They really do. They can be $0 a month. But on the back end, you've got out-of-pocket maximums and deductibles. And I mean, those can range from plan to plan. The highest out-of-pocket max on a Medicare Advantage plan is $6,700. So it might be cheap up front, but if you use your plan, you could end up paying for it on the back end. And the way I really try to look at it as a Medicare Supplement plan, you pay now. Advantage plan, you pay later. You're going to pay either way, but you really want to limit it to paying as little as possible with as much freedom as you can possibly have. So yeah, those low premiums and add-ins might look enticing, but you really need to look and see what you'll end up paying on the back end if you have to use your plan. Something to really think about. I hope you found this information helpful, kind of explaining the different parts of Medicare. Again, I know it's really overwhelming when you get into it. I love to help you as much as I can. If you can give me a call, again, my number is 833-65-JAMIE. Visit my website, medicarebyjamie.com, or you can shoot me an email, jamie@medicarebyjamie.com. I'll work with you to get you the best Medicare supplement plan and help you really understand Medicare, because that's my goal, is to make sure you make the most informed decision you possibly can. Stay tuned. I'm going to show you exactly how to use my website and request some information, like that Medicare supplement plan quote, as well as all the free resources I have. So again, if you like this video, please give it a thumbs up and subscribe and leave a comment. Thank you for watching. Talk about Medicare Explained. Hi, I'm Jamie Banner, the founder of Medicare by Jamie. I'm going to give you a quick run through of my website so you can easily navigate and find all the important links and information I provided for you. So when we get started, we're going to be right on the home page, and the first thing you can see is you can request a Medicare supplement plan quote. And that's what I do. I assist people in finding the best Medicare supplement plan options for them. So if you go ahead and put your zip code in there and a couple other basic pieces of information, I can get you the best supplement plan quote in your area. Once we get away from there and we go up to the top, we can see the Resource Center. So if we click on the Resource Center, we've got a couple options under there. The first one's going to be Video Library. So when we click there, it's going to take you to a page that shows you all of my YouTube videos. So all my videos will be on there along with their titles, so you can easily kind of search through them and see what video you're looking for based on your current needs. There's also a button up there that says subscribe to YouTube. So that will take you straight to my YouTube channel where you can subscribe, comment, do whatever you need, and find all the videos you need. When we go back to the Resource Center, the next link is going to say important links. And that's going to be a ton of different hyperlinks that give a lot of information, like finding doctors that take Medicare, maybe filing a claim if you had something, lots of different things that can take you out to show you things you can do for Medicare. And the last section is going to be guides and forms. Now, this one is really important. I've listed a ton of forms that are going to be very important for Medicare. Stuff like employer coverage forms if you're still working past 65, IRMA appeal forms, maybe if you need to check your Part B premium based on your income. I have all of that here, plus a lot of different informative PDFs that's going to give you as much information as you need in Medicare, because that's what we want. We want you to be completely educated on everything Medicare related so you can make the best and most informed decision. I've also got it up here where everything is divided into categories. So if you need to find something a little bit faster, just click one of these categories and it's going to narrow it down to things involved in that section. Again, if you have any questions, you can always call me. My number is 833-65-JAMIE. You can also email me at jamie@medicarebyjamie.com, or you can go to the website and hit the Contact Us button and you can send me a little information. I hope you found this video helpful and thank you for watching.